Candida causes the disease Candidiasis. Now, this is an opportunistic fungus, meaning that if it finds an opportunity, it can enter your body and cause serious diseases. Now, the organism in the genus Candida, which we'll study, that will cause a certain type of diseases is Candida Albican. Now, Candida Albican is not dimorphic, meaning that it does not form different types of structures, whether inside or outside the body, meaning that whether inside or outside the body, it has only one shape, that is, it is in the form of yeast. Now, this yeast is a single oval cell which has a bud. But in some cases or at some time, it also forms hyphae, but these type of hyphae are actually pseudo-hyphae, meaning that they are not true hyphae, but they appear so when they are inside the tissue or outside. Now, this Candida, it's also part of our normal flora, meaning that it is seen in the human body. It can be seen in your upper respiratory tract. This is this location. It can be also found on the skin. It can also be found in your genital tract, and it can also be seen in the GIT. Oh, your genital is supposed to be here. Okay. C. albican is differentiated from all of the other genuses in the Candida species or genus, that it can ferment carbohydrates. Now, this organism is present anywhere in the soil or in your normal flora. So whenever it is going to find an opportunity, it is going to get inside your body. Now, how it is getting inside your body? That the normal flora is also present on the skin and mucosa. So if you have a skin abrasion due to what causes needle or by catheters, IV catheters actually, this organism enters through those spaces and cause various diseases. But in order to cause a disease which is actually more apparent is when the human host defenses are weak. When the human host defenses are weak, there is a lot, and there is no one to kill it. When it goes inside the body, it can cause serious manifestation. Now, what is manifested? If in the oral mucosa, it forms into an thrush. Now, if you see the oral cavity, and these are your teeth, various form of different teeth, and this is your tongue. Now, and this is your uvula, a very bad diagram. So, but still, there will be a white, not plaky, white covering over the dorsum of your tongue. This white covering over the dorsum of the tongue, which is forming a pseudomembrane over your tongue, is known as thrush. Now, it can be due to all other diseases like lichen planus, so you need to be mindful of that, but it can also be Candida albicans unless proven not. It can also grow. Your mucus is also in your vaginal tract, so it will, in the vagina, what will it cause? It will cause itching, discomfort. And why is it infecting the vagina? Normally, a vagina consists upon a special layer of mucosa, which consists upon special organisms which are known as the lactobacillus. Now, this lactobacillus decreases the pH into an acidic environment, meaning that no organism can be able to grow in here. So, what happens is that if the lactobacillus number decreases due to specific diseases, or the patient is taking certain type of antibiotics which is causing the number to decrease, this would result in increase of the pH, meaning that they would be more alkaline. Now, our diabetics also have an alkaline pH. Similarly, they are more affected by C. albicans. Now, this organism will go ascend upwards and it will cause vaginitis. Apart from that, it is affecting the skin of the moist areas. Now, where are moist areas? Moist areas are normally a baby's bum, which is quite moist because they urinate in their respective diapers. So, the type of infection which babies get is a diaper rash, and dishwashers whose hands are continuously exposed to water, so their nails are mostly affected, and their tips of their fingers, where this organism commonly grows. This organism also affects, and the fungus albicans also affects the immunocompromised people. In immunocompromised people, it is not only restricted to the area of infection that where it is grown, it can be disseminated to the rest of the body. And similarly, it can manifest as a much serious disease, which is known as chronic mucocutaneous candidiasis. Chronic mucocutaneous candidiasis, also known as CMC. In immunocompromised patients, this disease manifests to various parts of the body, such as the lungs, the esophagus, the stomach, the small GIT, the large GIT, and disseminates to other parts of the body, even the brain, and cause meningitis, is because these immunocompromised people have a specific type of depressed immunity. And other type of patients which have depressed immunity is because of the mutation in T helper 17 cells. Now these T helper 17 cells, what helps is they form or they awaken other type of killer cells, and they tell them to come and destroy a specific antigen. Because they are mutated or they are not present, they cannot awoken natural killer cells or antigen presenting cells, due to which antibodies can be formed against these type of bacteria. Okay, now if such predisposition occurs, we know that it can also lead to severe cases, such as it can cause right-sided endocarditis, meaning forming vegetation on the valves which are present on the right side of the heart, and it can cause ophthalmitis, which is basically an eye disease, and Candida can cause esophagitis. This esophagitis is normally seen in patients having leukemia and lymphoma, as along with subcutaneous nodules, which are seen in neutropenic patients, in which neutrophil count is comparatively less. Now, how do you diagnose it? You can diagnose this based on labs. We can take a tissue from the human, and we will see obviously this yeast, which is a budding yeast, small cells with buds. Now, this can be only seen with a special stain, which is known as the calcofluor white staining. Calcofluor white staining. Now you need to remember this because it's quite important. This organism resembles that the Staphylococcus colonies, as you can see, small babies. And another test in order to differentiate C. albicans from all of the other Candida, because it is so wide in this environment. So what happens is we take a germ tube. In germ tube, we take serum and we take it at 37-degree temperature, which is the normal body temperature, and this will differentiate Candida albicans from all of the other albicans, Candida species actually. Now, how do you treat Candida? Now, the oral thrush is quite common and it is quite prominent because a Candida is a part of your normal flora, and time to time we get immunocompromised, we get immunodeficient, so this oral thrush grows. So in such patients, we advise the patient to have fluconazole, itraconazole, or caspofungin in severe cases if this is not resolving it. In the skin cases, we give the patient nystatin or cotrimoxazole, or in mucocutaneous, if it involving your oral mucosa, what we give the patient is ketoconazole or Canalog. In disseminated cases in which the immune system is compromised, we give the patient fluconazole if there is meningitis, because this penetrates quite well through the CNS, and amphotericin B, which is our last resort.